The rotator cuff is a group of 4 muscles in your shoulder. These muscles and their tendons surround your shoulder joint. They help you lift and rotate your arm, and they also keep your shoulder stable. These muscles are essential for everyday activities. You use your rotator cuff when you reach overhead, lift objects, or throw a ball. These muscles are also active in sports like tennis, baseball, and volleyball. The rotator cuff muscles are susceptible to injury due to overuse, repetitive motions, and aging. Understanding the anatomy and function of the rotator cuff is crucial for recognizing, preventing, and treating injuries effectively. By taking steps to protect your rotator cuff, you can maintain the health and function of your shoulder joint and continue enjoying your favorite activities. Rotator cuff injuries are common, especially in people who play sports or do repetitive overhead work. These injuries can range from mild inflammation to complete tears in the muscles or tendons. One of the most common symptoms is pain in the shoulder. This pain may be worse at night or when you lift your arm. You may also feel pain when you try to reach behind your back. Other symptoms of a rotator cuff injury include weakness in the shoulder and arm. You may also have difficulty lifting your arm or rotating it. Some people also experience a clicking or popping sound when they move their shoulder. If you experience any of these symptoms, seeing a doctor to get a diagnosis and start treatment is important. Rotator cuff tears can occur gradually over time or suddenly due to an acute injury. Repetitive overhead activities like painting or playing tennis can irritate and inflame the rotator cuff tendons, leading to tears. As we age, the risk of rotator cuff tears increases due to the natural wear and tear on the tendons. The blood supply to the tendons also decreases with age, making them more susceptible to injury and slower to heal. Falls or direct blows to the shoulder can cause acute rotator cuff tears. These traumatic injuries often occur during sports or accidents. Understanding the causes of rotator cuff tears can help you make informed decisions about your activities and take steps to prevent future injuries. Section 4. Effective treatment options for rotator cuff injuries. Treatment for rotator cuff injuries depends on the severity of the injury. For minor strains or tendinitis, rest, ice, and over-the-counter pain relievers may be sufficient. Physical therapy is often recommended to help restore range of motion and strengthen the muscles surrounding the shoulder. In some cases, your doctor may recommend corticosteroid injections to reduce pain and inflammation. These injections can provide temporary relief but are not a long-term solution. For severe tears or tears that do not respond to conservative treatment, surgery may be necessary. Surgical options include arthroscopic repair and open repair. These procedures aim to reattach the torn tendon to the bone and repair any damage to the surrounding tissues. Following your doctor's recommendations and adhering to your rehabilitation plan is crucial for a successful recovery. Section 5. Preventing and rehabilitating rotator cuff injuries. Tips for recovery. Preventing rotator cuff injuries involves taking steps to protect your shoulders during activities and strengthening the muscles surrounding the joint. Before engaging in any exercise or sports, warm up properly to prepare your muscles for activity. Use proper techniques for overhead activities, such as lifting weights or playing sports like tennis or volleyball. Avoid repetitive overhead motions whenever possible, and take breaks when necessary. If you experience a rotator cuff injury, follow your doctor's recommendations for rest and rehabilitation. Physical therapy plays a crucial role in restoring strength, flexibility, and range of motion to your shoulder. Your physical therapist will guide you through specific exercises tailored to your individual needs. Consistency and patience are key during rehabilitation, as it takes time for the muscles and tendons to heal properly. Section 6. Stay informed. Your guide to shoulder health. Rotator cuff injuries are a common cause of shoulder pain and disability. Understanding the causes, symptoms, and treatment options can help you make informed decisions about your health. Remember to prioritize prevention by warming up properly, using proper techniques, and avoiding overuse. If you experience a shoulder injury, seek prompt medical attention to receive an accurate diagnosis and appropriate treatment. Thank you for taking the time to learn about rotator cuff injuries. For more informative articles and tips on shoulder health and injury prevention, follow me. Let's work together to keep your shoulders strong and pain-free.